Hi, I'm Dr. Kuzo Sibitsiva, and this is Tiny Matters with Dr. K, the show that helps you navigate the little things that actually make a big difference when it comes to your child. Today's episode is about something that every single parent has asked at some point. Is this normal? Whether it's about how your child eats, behavior, tantrums, or even their development, it's a question that slowly lurks in every parent's mind. So let's talk about what normal is and why that word can do more harm than good. Let's start with this. Normal is a range. Children grow, behave, and develop in a way that is deeply unique and individual to all of them. Some may walk at 9 months, some at 16. Some may be speaking in full sentences by 2.5, and some only after the age of 3. What's more important is the trajectory and not the timeline. You guessed it, it's time for another story. I once had a mom who was worried that her 2-year-old was not speaking as much as her neighbor's child. He was engaged, playful, and attentive, and following instructions, but just not saying too much. We monitored him without rushing to label, and by 3, he was speaking. That extra reassurance allowed her to parent without panicking. The thing about labels like delayed or normal can cause shame, panic, or embarrassment. We need to be careful how we use them. So when it comes to milestones, when is it truly time to worry? It's important to trust your instincts, but also to know when to seek support. Some developmental delays are just a unique part of your child's development. Others might need intervention. Here are a few moments where I tell parents that it may be time to explore further. Number 1, no eye contact or smiling by 3 months. 2, not responding to their name by 12 months. 3, not pointing or using gestures by 15 months. 4, regression, which means losing skills that they had before. And number 5, lack of interest in people or play. Now let's talk about the role of stimulation. Children's brains thrive on interaction, talking, playing, singing, and reading. No app can ever replace a caregiver's lap, a parent's voice, or a shared laugh. Even 5 minutes of intentional engagement a day can support your child's development and emotional regulation. Let's be honest, screens are everywhere, and sometimes lifesavers when it comes to parenting. But overuse, particularly in children under the age of 2, can be detrimental to brain development and social interaction, as well as speech. Here are a few practical ways of how we can reduce screen time. 1. Swap a cartoon for a real-life book. 2. Let them help with simple chores. It builds motor and language skills. 3. Narrate your day. Describe what you see, feel, and do. And number 4. Use music and movement for bonding and stimulation. Tiny tools for parents. Use milestone charts as a guide, not a verdict. Avoid comparing kids in different families, even siblings. Document your child's growth with videos, drawings, and notes as it shows you progress. And trust your gut and your child's pace. There's no such thing as a perfectly normal child. There's only your child in their own unique rhythm and pace. Let's raise them to be seen, not just measured. Thank you for joining us on Tiny Matters with Dr. K. If this helped you feel seen, share it with your friend. And remember, stay kind, stay curious.